Hey folks, welcome to another episode of Growing Our Future. My name is Stephen Lucky with Gardopia Gardens, and I have some special guests from the city of San Antonio Metro Health today. Welcome, how's it going, y'all?
Great, thanks for having us.
So we have Nadia and Jay Shakarla. Go ahead and let's start out. Just tell us a little bit about who you are before we start getting into Metro Health. And the reason that we're recording today is because Metro Health is supporting some amazing initiatives that we're partnering with y'all on. But what's your background?
Sure. So hi everyone, my name's Nadia Gaona. Currently I'm a policy and partnerships analyst with our policy and civic engagement office at Metro Health. I've been with the office almost 2 years now. Previously I was a community health worker with our Healthy Neighborhoods team at Metro Health for about 7 years, working in the Villa Coronado neighborhood on the south side. Mm-hmm. And before that, I've known Stephen quite a long while doing garden-based education work with the Bexar County Master Gardeners, Community Gardens Program, Green Spaces Alliance, and with a permaculture group in San Antonio. So definitely been working together on different things for a long time, and also a board member with the Food Policy Council of San Antonio, where our main project that I'm working on is the Tumultulam Food Forest.
Yes, wonderful. Thank you. Jay Shakarla?
Hi, I'm Jay Shakarla Adkins. I go by Jay. I'm the policy and partnerships coordinator with the PACE office under San Antonio Metro Health. I'm actually, I have a background in education, like administration, research, and development.
Okay.
So the health policy world or health department is new to me, but I'm glad to be there.
Awesome.
Yeah.
And so how did y'all find your way to applying for a City of San Antonio Metro Health job? You know, because working for the government's different, right? And so, like, were you like, I want to go be a policy person? Like, I want to go work for the government. I want to go work for San Antonio. Like, what brought y'all there?
Yeah, that's a really good question, Stephen. So I never thought I would be working for the government initially. So I started out working as a community organizer, volunteering really. Mm-hmm. And it was through the volunteer work that I was doing with the Community Gardens program, starting things like Common Ground, events at Eco Centro, working with all sorts of different folks, that just started meeting people and learning about the Healthy Neighborhoods program and community health workers. And I was like, wow, you can do this for a living? Like, this is a job?
Yeah.
Like meeting Edward, who was working in Avenida Guadalupe on the west side, who was pulling out his iPad. And I was like, this is great. Like, I would love to do this. And just making those connections and wanting to, grow in my facilitation skills and whatnot, and finding a way into the health department by applying as a community health worker.
Okay, wonderful. I do remember Common Ground back at Eco Centro. I remember Skeets had his juice truck there, the bus, and so many great folks. I think maybe Jess was there at some point. So yeah, man, time has flown by. And then I remember going to the SATX permaculture educational events y'all had as well over at SWU and other places. So that's awesome that you were able to navigate your way to that point. What about you, Jay?
Coming to Metro Health was totally, it was just an opportunity that kind of fell into my lap. I was looking for something different. I've always been in operations, and I was working primarily in a finance role.
Okay.
And I found out that I did not like it. So it just literally, the opportunity kind of just fell into my lap, and I'm at Metro Health.
Awesome. Well, we've been working with Metro Health from pretty early on. I remember Anna Mackneck, who's with the is it Healthy Neighborhoods program? Yeah, where the community health workers are located. So we helped build a garden at the WIC Clinic at the Pecan Valley. Super appreciative. And then at the Villa Coronado Community Center and Recreation Center over there as well. And, I think it's just so important for our community to be healthy, right? And health means so much to so many different people, right? And so your focus on health and Metro Health is what at this point?
Right. So you bring up a really good point. Health is like very holistic. It involves like so many different determinants. We talk a lot about the social determinants of health and the environmental factors that shape people's health outcomes. So our main initiative right now through our Policy and Civic Engagement Office is we are the backbone team for a health equity network that includes access to respectful care, housing stability, and food insecurity. So we're looking at all of these social determinants, all of these factors. We're bringing people together from all of these different departments, community-based organizations and people with lived experience to analyze those factors and to understand what are the root causes of food insecurity and what do we need to do collectively to make those changes to see the trend line move down as far as food insecurity goes and up as far as food security goes.
Nice, you said that a few times, huh? I like it, yes. Well, Jay Shakarla, you want to add on to that?
I think I'm 7 months in, but one of the things I would like to recognize is the group has been meeting over a year to basically come together to develop some metrics, and also for us to test the metrics. So we're actually getting ready to start collecting data from all of the work that the group has done. So it's really exciting. We're at an exciting time right now.
Yeah. Well, I remember the first meeting at Young Women's Leadership Academy back in March of 23.
Thanks for making that connection.
Yeah, of course. Thank y'all for having it there. And then now y'all have been meeting at a Head Start, and now it's meeting over at the Area Foundation, right?
Yeah.
I still haven't made it there yet. I need to. I used to teach at that gym. That was Gold's Gym in the Concord.
Oh, okay.
Yeah.
Cool.
So I used to teach a 5 a.m. yoga class.
Oh, wow.
I know.
I
I'd
would
show
not
up
have been making
like
it
at
to your
5:50. I'm like,
class.
sorry.
5 a.m.
Yeah, it was tough. But all that being said, those meetings, I commend y'all because I know sometimes it's hard to get people together, right? One. And then it's hard to be like, yo, this is going to take a year plus, right? Just for us to make a plan.
Right.
Right. And some people can get very impatient and be like, I'm ready, let's go. We've been doing this, we're ready to do this. But there's that saying, if you want to go fast, go alone. If you want to go far, right, go together. And so I really appreciate and respect that y'all stayed at it. And being a backbone organization is tough, right? To have the funding, to have the staff capacity, and then to have the vision to move that stuff forward. So PACE office, this specifically that I want to talk about today is on the food security side. Tell us a little bit about what's happening and some initiatives with that.
So right now we have the Health Equity Networks. Garthopia is one of our sponsors. We have two other organizations, the YWCA and the San Antonio Food Bank. And can I give dates to?
Come on, yeah.
Okay, so the San Antonio Food Bank, they have their market and walk-up distribution on September the 4th. Particularly, they are targeting college students. It is for everyone, so anyone who comes, they will be served. But the target population for that health equity market is college students.
When is it, or where is it?
It will be at the University of Incumbent Work.
Go Cards!
Yeah.
All right.
So the next market is with the YWCA. It's being held along with their newcomers event. So in that they're basically focusing their market towards immigrants who are new to the United States. So they'll have resources and tools out there available for immigrants who are there, along with the Health Equity Network pop-up market. And I forgot to add that they're distributing food at these markets. So so the food bank, the YWCA, and then the third one is Garthopia. You all will be having your fall equinox, and of course your garden. So you will be distributing food. But you guys are located here on the east side, so the population target is African American. So, and we're really excited about these. These are the second rounds of pop-up markets. We've already had the first set starting in June all the way up to August. So we're excited. We're excited to spread awareness about food insecurity, also do our part with distributing the food within our community.
And so food insecurity is big in San Antonio. It's throughout the nation, throughout the planet. And it's weird because there's enough food, right? There's enough food for everybody, but it's the distribution of the food, it's the cost of the food, it's the access of the food. There's a lot of barriers to getting to that food. And so, the strategy that y'all are taking, I know that the SA Forward is trying to reduce food insecurity 5% in 5 years. Tell me a little bit about the strategies and like what y'all are hoping to achieve long term.
Right. And you bring up a good point. We talk a lot about the 3 pillars of food insecurity, so availability, access, and nutrition and utilization. So it's been really cool to see the work group participants. Basically, different participants cover different areas and all coming together to see how can we support all of these different pillars? How can we increase access? How can we support policies that help it to where people don't have to make these choices and these trade-offs over, am I going to pay rent, or am I going to be able to feed my family? Am I going to be able to pay that doctor bill, or am I going to be able to feed my family? All of these things are interrelated. And just to add on to the pop-up markets, another thing that, one of the strategies that the work group members have identified is this concept of wraparound services, right? Mm-hmm. So if we are going to be distributing food, making sure that we are providing also housing voucher information, or information on low-cost medical services, all of those different things, making sure that whatever we do, it's holistic, it has all of those different components wrapped together, because we know that like food insecurity is not in a vacuum. It's made up of all these other different components.
Tell me those 3 pillars again.
Access, availability, and nutrition and utilization.
Nutrition and utilization. Okay, awesome.
Yeah.
Okay, man. What are you gonna say? Anything, Jakar?
Oh no,
Jay?
I was just enjoying.
Hey, me too. I'm with it. I didn't know about the 3 pillars, so
Yeah.
I learned something new today.
Yeah.
Access again isn't biased, right? So there's food deserts, and food swamps as well. Availability. Tell me about availability. Is that like? Tell me the difference between access and availability.
Yeah. So access, it really includes all of those different other things we were talking about. Like, do people have enough money to buy food? Like, do they have enough well-paying jobs? Like, it's basically around income and economic stability.
Okay.
It's also around transportation, also around those housing trade-offs that people have to make. Basically, are there other things that are making it to where people do not have access to be able to purchase the food that they want to need? Because availability, like you were mentioning earlier, it's not that it's not there, it's there, right? But availability is around supply chains, it's around is food being produced locally? Is it something that's actually there in the markets? That's kind of healthy corner store stuff too, those are availability. And nutrition and utilization is all around cultural preferences, knowledge of food use, how to prepare certain types of food. We talk a lot about how, there might be a distribution and it might be a box of kale or something, but if people are not used to eating kale, or if they don't know how to prepare
and I can only eat so much kale.
Yeah, and you can only eat so much of it, So knowing that those 3 things work hand in hand in order for people to have the food that they want and need to feed themselves and their family.
Okay, wonderful. Thank you, Professor Nadia. Well, for us, so thankful that y'all chose us as a pop-up market site, because I think a big part of it is, we have meetings during the day and we send out emails and we're on social media, but those gathering spaces, right? No. Where it's not about business, it's about community, it's about celebration, it's about getting outside, right? So, we've been doing our markets for a while, but really y'all are providing a stimulant and a catalyst into this work to take it to the next level.
100%.
Right, to be able to really engage with our community members. I got to give a shout out also to Parks and Rec, right? So we do tree adoptions as well. But, when people are shopping over there for free, they're like, how much does it cost? Oh, no, just grab a bag. That's it, right? It's that simple. I actually had somebody send us a message. They're like, hey, if I don't register, can I still shop? Yeah, it's open to the community. So y'all can come out on September 22nd. It's the fall equinox. It's actually the day of the fall equinox, September 22nd. So we'll be transitioning into a new season. And with Metro Health, we're transitioning into a new season. So what do we have to look forward to with the HIN and the PACE office as we move into this new year, this new fiscal year?
Yeah, right on. So one of the things that is coming soon is we've been working on it's been a year in the making, a food insecurity assessment with our partners at UT Health Houston. They already conducted a baseline data, gathering of baseline data around food insecurity. There's a dashboard that's up, And for like the last year, they've been working on part 3 of that assessment, which has been more of a participatory component. So basically going out and talking to people, doing surveys, doing focus groups, and doing these community conversations where it's not just providing information, but it's talking to people, it's having conversations, it's creating spaces where people can talk to each other. Like you were saying, that part is really important, providing spaces for people to gather, because people have the solutions, right? And it's not necessarily just this top-down thing that Metro has, but it's about building those relationships. It's you guys have the relationships, right? And you brought up something really cool too, is like those mini grants that the PACE office is offering to different community-based organizations. Because the community-based organizations, they have those relationships, they've done the work before, but being able to provide like that added boost, like you were saying, because we know that they're the ones doing the work, and just how can we help facilitate that a little bit more. Yeah, so that food insecurity assessment's coming out by the end of September, so there'll be a report out. And at the YWCA market, there's going to be a table there with the researchers, and they're going to be presenting some of that data back. We're going to continue looking for opportunities where people are gathering to have little stations to be able to present that data back, and continue having that like reciprocal data providing and data gathering, and creating those spaces where people are learning about food insecurity, and we're democratizing data basically so that people have a say. We're building community power to be able to make these changes together, not just top down.
And you also had mentioned the community conversations. Are those up and coming, or tell me a little about that?
Yeah, so we were able to have our final one. We had about 5 between February and June. So the final one was at Harlandale Makerspace. Shout out Harlandale Makerspace.
Yeah,
That's
Charles.
a really good, Charles. What's up, Charles? Thank you so much for partnering with us on that. It was a really good conversation. Also with the Harlandale Sunshine Pantry, as part of the Free Little Pantry Network. They're really amazing partners, and we were able to bring together, it was about like 40 or 50 people from the Southside community to talk about what they see as far as food insecurity goes, what things need to change. And we want to continue having those with our partner organizations in the HEN, being able to provide training on how to have those, training on participatory action research, so that we can kind of keep it going. You know, it doesn't have to end there at the end of the assessment.
So let's say that, I'm trying to think of her name. Who's Jeff Bezos' ex-wife?
Oh.
The lady who's just dropping millions on everybody.
Yes.
So Mackenzie Scott. Mackenzie, come on, drop some money on us. If Mackenzie dropped $100 million into Metro Health to address food security, what are you doing?
I think we're finding ways to get that funding out to the people doing the work on the ground.
Get it out to the organizations. Okay.
I hope I'm not speaking up for
our food assessment. There's ways that were listed. So, and one of the ones is what are one of the ones? Because you're a little bit more knowledgeable.
For the food insecurity assessment, as far as strategies?
Yeah, strategies.
Yeah, so it definitely said, the one I know the most about is the oh gosh, here we go.
I got it. I see it. But one of the strategies is it's not necessarily.
What's our group called, Stephen?
What's that? Our group?
Yeah, it's a group that you're in.
Charitable assistance.
In the charitable assistance.
Yeah.
Thank you. So the strategy I know the most about is the charitable assistance strategy, which is around making it easier for different organizations providing charitable assistance to do their work, like providing funding streams, providing training and capacity building so that they're able to do things in a way that increases food choice for folks, things like that. So supporting charitable assistance, increasing housing stability, so finding ways to get those voucher programs out, getting people housed, finding affordable housing options that are truly affordable. They don't just say they're affordable, but they're really affordable. And then also around the SNAP initiatives and the federal programs, being able to increase the amount of navigators, helping people sign up for SNAP, making SNAP from a 6-month, where you have to re-sign up in 6 months, to 12-month window. So that's something that's coming down from the Texas Food Policy Roundtable and Feeding Texas folks, that basically we're working to educate the folks in the food insecurity work group on all of these different initiatives and policies that are that we want to help focus on, so that we can start advocating for those.
Okay, those are three
Is there
great
something you wanted to add?
strategies.
No? Okay.
Yeah, no,
Excellent.
okay. So y'all have actually done some capacity building, supported some orgs, right? What does that look like, and what's the purpose of it?
So the capacity building grants is to pretty much test these, what Nadia just talked about, to test those strategies within the community. So, and it's not for orgs to change their work, but to, again, increase the capacity in the work that they're already doing.
Mm-hmm.
And the grants are different amounts according to the size of the organization.
Mm-hmm.
And we do have one currently open right now
Mm-hmm.
for Health Equity Network partners.
Oh, shoot.
So, and we hope to continue that as we continue in the work, and we hope to continue to give those capacity building grants. Yeah.
Well, that's wonderful. So I also sit on the Food Policy Council's board, and I know it's been very beneficial. It's allowing us to have the conversation and then have money to enact it, right?
Right.
I don't want to talk about something if I don't have any funding for it. Why are we talking about building capacity? Why are we talking about hiring people? Why are we talking about changing our website? We don't have the money for it. It doesn't make any sense. But we know what we want to do, and so having the funding behind it to allow us to do it has really elevated the conversation, I'll say.
That's good to
And I
know.
think too is a lot of our charitable assistance orgs, they're smaller
Mm-hmm.
or medium size, and this funding really helps them because it's hard for them to compete with other agencies.
Mm-hmm.
But this really, as you stated, and I love the way that you said that, it really gives them the help financially needed for them to have those type of conversations of how can we expand our work.
Mm-hmm.
So I really love that.
Wonderful. So as we wrap up, how can people get involved? How can they reach out to you to be involved in the HIN?
So if you would like some more information on the Health Equity Network, you can reach out to us at healthequitynetwork@sanantonio.gov. It's a long email address, but healthequitynetwork@sanantonio.gov.
Can we just get HIN at sanantonio.gov?
Oh, man. Work on that.
In the future. All right, Health Equity Network at sanantonio.gov.
And
Perfect.
you can Google SA Forward and the food insecurity and nutrition priority area, as well as the equity and justice priority area that was basically how the PACE office was created.
Wonderful. Well, thank you all both for being here.
Thank you.
Hopefully y'all learned something today. Get involved. Food insecurity is a huge issue, again, throughout the nation. But San Antonio is taking steps forward, and it's because of great folks like this. If you had one garden sign for people to see when they entered, what would it say?
So I have to go with the tried and true compost happens from my mentor, Malcolm Beck.
Yeah,
Garden
Malcolm. Okay, what about you, Jay?
My sign would be free food.
Free food. All right, man. I'm coming to y'all's gardens. There we are. Yes, wonderful. All right, y'all. So compost happens, and guess what compost can make? Free food. All right, till next time.